We will just run about dental caries and then methods of preventing dental caries, in which I will be talking majoritarily about fluorides. Okay. And after that, we will go to some MCQs which are related to dental caries, fluorides and plaque control. The teeth which are most susceptible to dental caries is what? Lower canines are the least affected and the mandibular molars are the most affected ones. Lower cuspids are the least affected, and again you have a gradating. First, the occlusal surface is affected, followed by the mesial, buccal and then the lingual surfaces. Okay, this is mesial and distal. And these are the various theories which have been proposed, but the most accepted ones is the Miller's chemoparasitic theory. What is that acid which is produced during dental caries? Lactic acid is the end product because of which demineralization of the tooth takes place. So you have, as you all know, host factors, agent factors and environmental factors. Among host factors, the most important one is the tooth, supposed to have a specific gravity which is very close to that of diamond, and the maximum thickness is in the cuspal tips. That is why the cuspal tips seem to be the areas which are least affected by dental caries. Saliva is also an host factor, normally alkaline, but what is the critical pH? 5.5 is the critical pH. Normally it is alkaline. This is the normal quantity which is secreted, 60% of which is by the parotid, which is a predominant serous secretion, followed by submandibular and sublingual glands, which is a mixed gland. What is the role of viscosity in saliva? The more viscous, the more serous the secretion. Dental caries is, the more mucus the secretion, the more is the dental caries. More is the viscosity, more is the dental caries, and the main antimicrobial agent present in the saliva is the secretory IgA, okay, along with lactoperoxidase and lactoferrin. What is the difference between caries activity and caries susceptibility? Caries activity means number of new caries lesions. Number of new caries lesions, and susceptibility are host factors which make you susceptible to the caries. This is considered as the golden standard for all the caries activity test introduced by Hadley. Lactobacillus, there are two things, acidiuric bacteria and acidogenic bacteria. What do you mean by acidiuric? What is acidogenic? Lactobacillus is acidiuric or acidogenic. It is both acidiuric and acidogenic. That is why this is a secondary colonizer. Okay. But what you need to remember here is, you take patient's saliva and you use this in this medium called the tomato peptone agar, which is in an acidic pH, and you grow the colonies. Depending upon the number of colonies, you mark them whether having little or no caries, slightly conducive, moderately conducive, and marked caries activity. Okay, so this is what is your lactobacillus colony count test, which is considered as the golden standard for all caries activity tests. Next is what is called as the Snyder's test. Snyder's test does not count the number of microorganisms, but it measures the ability of the organisms to produce the organic acid or the lactic acid which you told about. Okay, so what basically we do here is, we take this dye. This dye is called as bromocresol dye,